Welcome to EMDR Chat with Curt and Michelle. I'm Dr. Curtis Rounzen.
And I'm Dr. Michelle Gottlieb. Hey, Curt, guess what?
What?
We have a guest today.
You never told me this.
I know, it's a secret. I didn't want to tell you.
Okay.
But it was a surprise. I wanted to surprise you. Surprise!
I know we have a guest. Go ahead, introduce this gentleman. Thank you.
So our guest is Christopher Schamber. And Chris is someone that I've worked with on his journey of becoming certified. His passion for EMDR therapy knows no bounds. But he has another passion as well, CBT. And, we often talk about EMDR therapy not being CBT, but did you know there's actually ways that they can complement each other?
Absolutely. A lot of it can be complemented. I'm really interested in hearing it because, all of us old folks tended to come from a CBT orientation before EMDR came along. So that's really good.
So Chris, would you first just tell a little bit about your background and, how do these things complement each other?
Yeah, who are you?
Who am I? That's a great question.
It's a philosophical question, I think.
Yeah, I looked in the mirror and asked that earlier. So, my name is Chris Schamber. I'm an LCSW practicing here in California. I have worked in a few different types of settings, close to 7.5 years, working with the LA County Department of Mental Health, worked with drug court, DUI court, alternative high schools. So there's a lot of different areas in which I practiced. And I guess, my journey with these modalities was kind of interesting. Like a lot of people, I was exposed to CBT in grad school. I think that's one of those things where they want to give you very concrete skills to sort of put you out into the world and start doing some good work. So initially, that was kind of my exposure in some ways with CBT was like worksheets, and I found it like incredibly kind of frustrating and confining after a short time. So I was like, I don't know if this is for me. But I kept hearing about EMDR. I had a professor who was trained in EMDR and swore up and down about it. So I was like, okay, that's something I'll get to. And then I moved on into the workforce. And through LA County, I had the opportunity to connect with an organization called the Academy of CBT. They are a pretty pronounced organization in terms of training people on cognitive behavioral therapy. So that was a path that, as I went further and further down, I was like, wow, this is really exciting. It's not just worksheets, there's a lot more to it. There is room to be creative. There is room to kind of bring in all these different kinds of interventions as opposed to something super duper prescribed. So I went down that road, became certified. And then as time went on, I working in Department of Mental Health, trauma was this thing I was constantly experiencing. And while I found, CBT certainly has effective ways of getting to that, like exposure response prevention and all of that, which I did find helpful, I always was finding like, I'm missing something. I couldn't quite touch some of the underlying wounds and beliefs as easily or as well as I wanted to. So then, it was around that time I started reconsidering, okay, yeah, I remember this EMDR thing, let me look into that. I trained with you all, and it was this is an extreme word, but a borderline religious experience, just sort of like kind of just being able to hear things from this other perspective that I hadn't been exposed to, but it made so much sense. And it made so much sense in the work that I was doing every single day. So that really encouraged me, kind of going down this path of becoming EMDR certified. I'm a consultant in training now, hoping to get through that path as well soon. And similarly, though, I was also still very much in the CBT world and kind of continued that, became a CBT trainer consultant, leading trainings, consultation groups on that. And I love that too. So it's been kind of a funny position, kind of being a little bit split between two worlds. So I'm finding that I do a lot of translation in my head and also in some of my consult groups of like trying to use like language or ideas in one area and help move it to the other.
Which is a great thing that we have to do when we have to have different paradigms. So I'm curious, how do you translate that? How have you used CBT and EMDR to complement one another?
Yeah, I think for sure, it all starts with a solid understanding of both models. Like, you really need to know what is the theory behind these things, because if you're not careful, it can become really dangerous in a lot of ways if things become too muddled. So for me, initially, like one of the things I'm always asking myself is, first of all, I do a case conceptualization, like what is going on, how is this contributing to maladaptive behavior, thoughts, feelings, whatever. And then, from there, I try to understand, like, what are my options here? How can I best understand the problem? And how can I use these different paradigms to make sense of it? And so I think from my standpoint, there are areas of overlap, certainly. In the cognitive model, the AIP model, there are different ways in which we can kind of see them bounce off of one another. So I try to, both when I'm doing my direct services, clinical work, as well as when I'm consulting with people, I try to keep that part in mind.
Right. And this is kind of my question is, we talk about, both CBT and EMDR therapy are research evidence-based modalities with tons. There's probably, these two are probably the most evidence, most research. And what we know from the EMDR world, and I'm going to guess the same for CBT world, is that fidelity to the model keeps it the most effective. So how do you keep fidelity to each model and still make them complementary, right?
Yeah, that is a personal frustration that I run into a lot. Is there's a lot of people out there that are surely well-meaning, but they don't necessarily stick to the model. Certainly in EMDR world, right? We sort of encounter clients out there that say, "Oh yeah, I did EMDR for a little while. It was terrible. I felt worse and worse and worse." And I had a colleague that was describing this to me. She had an experience where she went in to work on, a dog attacked her at one point. And so I asked her more about her experience with EMDR, and like, man, it sounded nothing like the standard protocol. It was really something like, do kind of do like one set of bilaterals and talk about it for a while. And then, and so very quickly it became obvious, like, okay, this is part of the challenge of this sort of work, I think, is you want to proliferate these great models, these great treatments, but there also needs to be some sort of standard of care, right? Because that is what is researched. That's what we know is effective. So certainly, with CBT as well, CBT has different ways in which we evaluate it at the Academy of CBT. There's this cognitive therapy rating scale. It was developed by Dr. Beck back in 1980. Still is used today, which is an amazing thing. But that has like very specific, concrete ways in which, like, if I'm watching video of a therapist doing CBT, I'm kind of grading them in each of these domains. How adherent, not like how good the therapy is, but like how adherent they are. And I think some of those principles apply to EMDR too. Just like, good therapy, that is sometimes a subjective idea, but certainly we can measure how adherent they are to the protocol.
Yeah, EMDR has fidelity scales that's used in research also like that, so they, an outside observer can look and see whether or not someone's actually utilizing the protocol as it was developed. I'm curious, because in EMDR therapy, one of the parts of phase 3, the assessment or activation phase, is that we break down the components of the memory into the images, cognitions, emotion, sensation, and the C part of that is cognitions. I'm curious, how does the CBT, the background that you have, play a part in your helping elicit those irrational negative beliefs that are imparted at the time of the trauma.
Yeah, absolutely. I think for me, by the time we get to phase 3, of course, we're wanting to move through that quite quickly, in a handful of minutes. We want to kind of light up that target so that it is really tangible and working through the nervous system. So that sort of work I try to do even in phase
Mm-hmm.
1. Part of my idea around history taking, especially with some of my CBT background, is I'm trying to understand, like, what are the underlying beliefs? What is the core belief, to use a CBT term? What is the core belief that has emerged from the exposure to these traumatic experiences? Because if I know that, first of all, that helps guide my treatment planning. Like, oh, I kind of thought that this one memory was connected to this, but like the core belief is totally different than everything else. So that kind of adds a little bit of organization in my brain as far as like what is on a treatment plan versus another treatment plan. But also once that is established, and certainly there are different ways in CBT, there's things called like guided discovery or Socratic questioning that can kind of help dig underneath and find those core beliefs. Once I find those, I write them down on the top of my treatment plan, and that always is going to be part of my phase 3. I'm kind of asking, I'll give the client an opportunity to be able to articulate and look for the NC. But if it's too slogged down, if it's something that we're just not getting there for whatever reason, I'll throw that out there. I'll ask, like, does that feel like that resonates? And 95 times out of 100, it usually is.
Right.
Good.
And Curt, you're going to be able to tell me all this in just a second. Shapiro wrote a book years and years ago, obviously at this point, talking about how integrative EMDR therapy is. And so I'm hearing you, and it's not just CBT, it's all kinds of different therapies that can be integrated into EMDR therapy. But I hear phase 1 and phase 3 can really integrate well with EMDR, with CBT, in ways that, again, keep fidelity to the model. Are there other ways that it's complementary?
Mm-hmm. Absolutely. Phase 2, I would argue, is an enormous part. If you are thinking of utilizing CBT concepts with your EMDR practice, phase 2 is enormous. You could even argue if you had a client that you'd been doing CBT with. Sometimes we do this, right, where we're working in one model and then the clinical picture changes or whatnot, and then we make a shift,
Mm-hmm.
right? That if you were doing CBT with that person, that was phase 2. That was part of the preparation for the reprocessing that you're doing. So that in a sense, CBT is a phase 2 in and of itself. And also, there are a lot of skills. There are a lot of skills that CBT has. It is a funny model in the sense that it's a huge umbrella. There are so many different things that are connected to CBT. Like DBT, of course, is one that I am trained in DBT. I use some of those skills. Certainly, they are great for distress tolerance, emotional regulation. Those sorts of things can be really helpful if a person has to stop during the reprocessing phase. Those are things that we could have taught and practiced and hopefully turned to. Certainly when we're talking about phase 7 closure, that's another way that we can kind of bring in, these are things to kind of, not as homework, EMDR doesn't give homework, but these are things to sort of practice if you need to, over the next week, like in terms of regulating yourself. So CBT has a lot of options around that. And I think that phase 4, some of the cognitive interweaves as well, there's a lot that if you can. One of the hardest skills in CBT, I think, is the guided discovery part, the Socratic questioning. It becomes very, can become very intellectualized, which is not always a great thing in EMDR, but it is something that I find can really help with cognitive interweaves. If we've hit a stuck point, if we're looping for some reason, I try to fit in one question. I don't want to derail the process. One question that can really help move the client, jostle the stuckness. And I find that that's a CBT skill that translates pretty well.
Yes, I can see that 100%. And particularly cognitive interweaves, I find that we teach that, of course, but your own experience and your own background often is very helpful in developing useful cognitive interweaves. So I can see that very powerfully affecting that. Good.
So I have another question then. How do you make the decision, Chris, with the background, the wonderful, amazing, thorough background you have with both of these modalities, of with a client, when do you do CBT? When do you do EMDR therapy?
Yeah, that's a great question. I think for me, and I'd love to hear, if other people kind of practice this sort of like dual approach at different points, I'd love to hear other people's perspectives as well. For me personally, I find that, again, it all starts with like clinical formulation. What is it that's happening, right? What is the window of tolerance? I think that certainly, in my mind, anytime there is any sort of somatic stuff going on, I'm like almost immediately thinking EMDR. That is something that CBT has different ways over the long run. It can affect that, but EMDR is such a clean way to really address that piece. So that's one thing that I take into consideration. There are a lot of people out there, though, that and working in the community mental health field as long as I did, I saw a lot of people that just could not resonate with positive cognitions. It was like, I could give one to them, but that would be like telling them a story that they didn't believe, right? So I found that with CBT, one of the things that I found helpful in terms of the cognitive restructuring and kind of using that sort of paradigm, I was able to kind of help people at least grasp or connect with the idea of a PC. Maybe not. Maybe it's not something that's totally bought into. That's okay. I don't need them to be 100% bought into it. But I found that helped. That has helped me with the EMDR process on those particular cases, because if I can get them to sort of buy into that, like, okay, there is a chance of the PC having validity, then I'm able to oftentimes move through phase 4 and especially phase 5 more successfully.
Absolutely.
Yeah, good.
And you and I talked and thought about that oftentimes people who are trying to make that transition from fully CBT to EMDR therapy can be difficult for people to do that. Can you speak? I'm gonna mention your training in just a minute, but can you just speak
Sure.
a little bit about that bridge?
Yeah, it's a challenge, I think. It's a challenge for a few different reasons. For one, there's the very human element, right? Of it's hard to be in the learner's position sometimes. It's a very vulnerable place. I'll like speak for my own experience. Like I always have this urge. I want to know everything. I want to be good at it. It's important to me, So to try something new is it's just inherently difficult. Like there is some challenges around that. And there's also the fact that sometimes people, when they talk about switching from one model to another, there are some concerns that a person might have, and I just want to validate that. Like, it's good to have that. If that's your response of a little bit of worry when you're learning something new, I think to a degree that's a good thing, because there is a lot of responsibility in that. I think, again, if you always know what you're doing and why, that really helps. I'm one of those people that I just find that everything we know, everything we learn somehow connects to itself. I grew up more in like the arts area. That was kind of like an original passion of mine. And, when I started going into mental health, part of me initially was like, oh, this is totally different. And then the more I did it, it's like, wow, it's all an extension, right? It's all an extension of itself. And I think that when we tell clinicians to bring your authentic self, I think that's part of what we're saying is like, you have like innately human, unique perspective, and there is something that is extremely therapeutic about it. And what you say, like bringing the science on top of the human side, is something that is really helpful. So I think, again, if you, in terms of these different models, I mean, if you know what you're doing and why, like trying to really build understanding of theory, of the practice, the different nuances of these different things, that's a really solid place to be. It's a little, this is a metaphor I use sometimes. It's a little bit like jazz. You know, you really have to have a solid understanding of music theory to successfully perform jazz. Jazz breaks all the theory sometimes, but it does it because you know exactly why you're doing it.
Oh, it's a beautiful analogy.
Same thing. I use the same analogy, Chris, because that's where creativity in this whole thing. What I also love is that you're talking about two very researched, as Michelle said earlier, as we began, two very empirically validated approaches, and bringing them in and integrating them together. Not only the effectiveness of what that brings, but the fact that people that are doing that know that they're doing empirically validated treatment, and that's what I really, really approve of. That's wonderful.
So we are about out of time, as I alluded to. Chris is doing an advanced training for us on April 17th. No, seriously, did you not know that?
Oh my
God.
I can't imagine us having someone on our podcast that's going to be doing a workshop for us, Michelle.
So odd.
Weird.
So
that's
odd.
almost like a marketing thing, almost.
Shh, don't tell anyone. Shh. So April 17th, it's called the Cognitive Bridge, Strengthening Your EMDR Practice Through CBT Insights. And again, I think for those people who are trying to make that transition, trying to figure it out, I think it's going to be really helpful for you. It will become an on-demand as well. As always, if you're a listener, scroll, you're going to find a 10% coupon, so you can go listen to Chris some more. But Chris, thank you so much for all that you do and all that you're continuing to do.
And this is a wonderful...
Thank you so much for having me.
It's a wonderful introduction to what we're going to get in that workshop. So thank you very much, Chris. Yeah.
Absolutely. All right.
Thank you.
Until next time.
Stay well, everyone.
Go with that.